Commissioner Cowan? I can see you, but you're on mute, sir.
Did you say Gowan? I'm here.
Cowan.
Oh, sorry.
But you're next, ma'am. Commissioner Gowan.
Yes, I'm here.
Commissioner Galansky-Pizania.
I'm here.
Commissioner Joel Munguia? He might be a little bit late, as mentioned. Okay, Commissioner Neese? Commissioner Neese, is that you on the line? Unmute? He's on here. And Commissioner Tetro, I don't know if she'll be joining us for this first part of it.
Yes, just for the record, she'll be joining in after the discussion the first time.
Okay. Let's call the meeting to order.
Okay, we do have a quorum.
Welcome, everybody.
Okay. It is now 5:04. Notice of an emergency meeting of the City Commission of the City of Brownsville teleconference open meeting pursuant to Texas Government Code 551.045. The Texas Open Meetings Act notice is hereby given that the City Commission of the City of Brownsville will conduct a special meeting on Tuesday, July 21st, 2020 at 5 p.m. via teleconference meeting by logging on the Zoom site. We do have a quorum present. We will go ahead and begin with the invocation. Is Pastor Brad Burks on the line?
Yes, I am.
Thank you, sir.
Let's pray. Father God, we thank you for the many blessings we have in our nation and right here in Brownsville. I know that you're well aware of the challenges that we have right now. We've been asking for wisdom for our leaders, and so now we ask for wisdom for everyone living in Brownsville and surrounding communities. We ask you to give each of them wisdom. There are so many competing theories. We ask you to give all of us the discernment to understand and discern. Lord, we ask you again for this meeting to lead and guide our mayor, lead and guide our city commissioners, lead and guide everyone that's participating in this meeting for the very best for the city of Brownsville. And Lord, we thank you and we praise you for it in the name of Jesus Christ. Amen. And now let us have a moment of silence where each of us can add our prayers to what has been spoken. Amen.
Thank you, Pastor.
Next, we have the public comment period, Mayor. No one signed up for public comment, so we'll go ahead and move on to the next agenda item, which is the work session. The number 1 solid waste update by Republic Services.
Hello, Mayor, council members. Can you hear me? This is Omar Rodriguez, Republic Services. I'm the municipal sales manager. Can you all hear me?
Yes, sir. We can hear you just fine. Thank you.
Okay, thank you. So also on the line with Republic Services is our GM, Mr. John Dikla, and I believe our operations manager as well, Mr. Nick Barrera. I spoke with Mr. Bernal. He asked us to come on board and give you guys an update of where we stand. A lot of things going on, as we are all aware of, especially with these COVID matters. So I want to at least address some of these things. I know a call center was getting bombarded, and so just want to kind of come in here and give you all an update, and then of course have an open discussion with you guys. If there's any questions that you may have, then we can kind of go through that as well. So the presentation I have and showing here, we did get affected by COVID, as everybody else has been affected by it, but in our case, we did have seven drivers that were affected and unfortunately unable to come to work. Now, that doesn't mean that they were directly infected with COVID, but either came into some kind of exposure. Either the wife came into exposure with it, was positive, and just for that reason, because of the severity of transmission, they cannot come to work at that point. So in our case, it was 7 drivers that were affected and unable to come to work. As things progressed, things got a little bit worse. We had some more people coming in and out. We ended up having to call for SOS help. SOS help did come in, and they did bring 3 SOS drivers. We were able to attain 3. Now, what SOS is basically we go up north and say, hey, we need help down here. We're feeling it pretty bad. And so what we're basically essentially asking is for people to come down here into the hot zone and risk themselves to continue to try and provide the services. So we had three brave folks, two of which started to help relieve the city of Brownsville routes. As of today, we have 3 out of the 7 drivers back at work and one more returning hopefully within a week. We're waiting to see if he will test positive. So Lord willing, that will happen. As we continue to proceed with providing services during these times, of course, the possibility of delays can and will occur depending on how bad this situation gets with COVID. But we are trying to stay on top of all things and go from there. One of the things that in my discussions with the call center and trying to resolve these issues, we wanted to bring awareness to the residents and let them know that even though we might get behind on the routes, we have no intentions of leaving the routes unfinished. Things are very, very heavy right now. As far as solid waste is concerned, as far as brush and bulk is concerned, it's extremely heavy, heavier than normal. And I kind of put some of that data towards the end of it. We'll look at that as well. But if we do miss a section for whatever reason, our intention is to continue routes as we would normally do. So it's best if the residents leave the carts out at the curb. If they go to pick it up at night, they come back from work, or in the evening when they're going to roll it back in and realize that there's trash in it, leave it out. It needs to be left out because we do intend on finishing routes. If they bring it in, that's going to cause an inflow of calls, an increase in call volume to the Brownsville call center, just because then they're going to say, hey, they missed us. So just leave it out and we will continue to operate and finish all routes in a timely manner. We fully understand the importance of our essential services, but we also believe that safety is a priority. So for us, with our drivers being in your community, and as well as other employees, we cannot risk other employees. We're trying to do everything as safe as we can. We do ask for understanding and patience during this time with this pandemic. We're going to try and get through it as best as possible. To update council on the residential services. Work orders from the time frame of April through July 14. And it's the next slide in case the council has not seen it. I have my own hard copy, but I still see the last slide. But moving forward, we had quite a bit of calls coming in. We had to take some hard decisions. It wasn't not something we wanted to do, but unfortunately things have to be done and done right. And we started seeing that the call center was getting bombarded with a lot of calls and things weren't getting resolved. When we really looked into it, we found out it was a little bit bigger of a problem than we fully understood. So between the month of April 1 through 7/14, there was a total of 832 open work orders. Now that's unheard of, not something that has ever really happened. We always stay on top of it. I'm glad to be able to report that within a 48-hour time frame, we did resolve all of those calls plus whatever was pending for what we call current, right? So all pending work orders from that month, 4/1 through 7/14, have been completed. Everybody has been serviced. Everything has been closed through the call center. And we even got some thumbs up and some good emails and some praise for getting up to par. One of the things we had to do, unfortunately, there was personnel changes. So we found the problem. We knew what ended up happening, and we took action to try and resolve this problem, and we got it taken care of. So the only pending work orders as of right now is whatever is current. So for the week of whatever week we're currently in, if there's any calls pending, then we're working on those as we're going forward. The call center had reported the 832 pending work orders that were closed, and we will continue to work with the Brownsville call center with the weekly reports. Weekly reports were getting sent off, unfortunately, when our personnel was saying that, hey, everything was getting taken care of. It, in fact, was not. And so for that reason, we had to do what we had to do. Moving on to the cart replacement matters. I know that this has kind of been a little bit of a hiccup. Currently working on all cart replacement matters with most recent cart loads. We did receive a load. We have already placed another load in, another order for 2 more loads. So we're expecting that arrival to happen soon so we can continue to fulfill all work orders for cart replacements and or repairs. The new standard cart color moving forward, I know I spoke to the call center today and they're like, hey, did y'all change carts? Yes, we had actually sent out notice. One of the things we did was we're going to start moving forward with blue carts with black lids, simply because that is the actual color that we use nationally. Manufacturing wise, it's a standard color for us. It's much easier to get than the green carts. Green carts were actually special ordered. So in lieu of trying to stop any kind of slowing down of manufacturing or trying to deal with special orders of carts, if we go with just a standard color, we feel it's going to be much easier to get a hold of carts and it should be less of a problem. Now, transit and freight, it's still unsteady. I mean, they'll say, hey, you're going to get it by this time. And I mean, that's just kind of up in the air. And I think everybody realizes that. Anybody with an Amazon Prime account realizes that there's no such thing as next day anymore right now. So it's getting slightly better, but it's still kind of up in the air what happens. So we're working on all matters pertaining to audit findings on extra carts as well. The extra cart situation, when we do an audit, there's accounts where they'll have 2 carts and only paying for 1. So we want to try and get down to the bottom of that. With everything being so heavy, the cart being heavy and the brush and bulk being heavy, one of the things we want to do is try and be as efficient as we can. And so we want to kind of barrel down on those folks that have 2 carts but only paying for 1, because it's not going to help the matter at all. And one of the things we're going to be doing is I'm going to be working on getting a letter and getting it into city management and working together with city management on how we want to proceed with providing that notice over to the resident. Either they surrender the car because they realize they're not paying, or they need to basically just automatically be billed. And that is what we're trying to work on to see if we can address those matters and slow down that situation. Every year that we run an audit, it has progressively gotten worse. This last audit was probably by far one of the worst ones. So we're working on that, and we'll keep the city aware of what's going to happen with that and where we stand as far as audits are concerned. Based on the current solid waste and brush and bulk volumes, every bit helps to reduce these time delays and try and keep running logistically and efficiently as best as possible. This is the tonnage comparison. We want to provide council just an idea of what is being faced out at the curb for us and our trucks and our drivers. So what you're looking at here is in 2019 residential MSW, your trash, your carts, from January 1st, 2019 through July 6th, 2019. That was the amount collected. So 30,361.3 tons. In 2020, that same time frame, 32,611.17 tons. So a little over 2,200 tons more. When we break that down, that's actually equivalent to 249 truckloads, full truckloads, more of solid waste that we've collected in the same time frame. With people not working, people at home, and I think everybody can account for this. I mean, my household is a family of 4, usually 2 bags. And right now we're upwards of 4 or 5 bags. So, I mean, we understand it's heavy. The same thing with the brush and bulk. People are at home, can't really do much. What are they doing? They're cleaning up. They're doing a lot of cutting up branches and trees and yard work. So that same equivalent time frame, we're at 933.63 tons more, which is 274 more truckloads, grappler trucks of brush that we've collected in the same time frame. So again, we want to update you guys and then just have an open discussion with you guys. If y'all have any questions, like I said, my GM is also on. We can try and discuss any questions you may have or answer any questions you may have. And if it's an operational question, of course, I'll let them jump into the conversation. But that's kind of what we want to report to you all today.
Thank you, Mr. Rodriguez. I do have a couple comments. it seems like the commission can tell whether you're behind or how you're doing because we start getting calls about it right away. And I'm going to tell you, I've got the two things that I get called about most right now is in regards to COVID testing and trash pickup. And you guys are beating COVID testing right now in the middle of a pandemic. So this is something we hear about almost on a daily basis. Mm-hmm. I will give you credit for responding very quickly whenever there is an inquiry or whenever there is an issue. I would suggest maybe putting out the message a little bit on the fact that people need to leave their trash out in the event it's not picked up timely. Certainly the goal is to do this timely and not have these issues going forward. I understand the COVID issue. I understand you have some personnel down, but I also understand that you got to get them up and running as soon as possible to try and avoid these issues. But if you can, just try and put out some messaging on the fact that people need to leave their trash out in the event it's not picked up on a regular schedule. But let's try and avoid that going forward and try and get back on a regular schedule as soon as possible. But thank you.
Yes, so Mayor, we did do a press release. I worked with Ms. Elizabeth Walker, and we did put a press release. So I know we started working on getting that message out to the public because I think it's important. We don't want to, again, we don't want to leave any routes unfinished, but we also don't want the hiccup of they picked up the card and we went by the next day and then the call center is going to get that call that we missed it, right? So we did do a press release and we will be working on that. As far as getting behind, like, the situation we found out occurred, that should not happen again. I mean, we had to make a change, and we had to make a change because the ball was dropped, and it was dropped, unfortunately, in a very bad way. So the supervisor that's now in charge of all of the city of Brownsville was initially the person in charge before we made the change, and so we're back to that because it was working really well back then, and we had to make some changes for certain internal purposes, but we're back to that as well. So Hector Rodriguez is the supervisor for the city of Brownsville for the residential services of carts and brush and bulk. My understanding is call center is pretty happy about that, and we've got a bunch of green lights for it. So we don't have any intention of falling behind like that again. What we consider is normal is week of, we'll probably get behind a couple of routes here and there, but we intend to catch up. As far as brush and bulk, currently we're about 4 days behind, and that's just us being honest. It's extremely heavy, but we have every intentions of getting caught up by middle of next week on the brush and bulk. So that I can also tell y'all tonight.
Thank you.
Hey, Mayor, this is Nick Barrera. I'm the operations manager for Republic Services. And since last Wednesday, our residential routes have completed every day. Before this meeting, I just got a phone call from our supervisor, and we are 100% complete on the routes that we were running today as far as municipal solid waste trash. So since last Wednesday, we have completed every route that day. So making that personnel change, we believe that helped tremendously, and we should not see that problem moving forward. And obviously getting in the SOS as well. I just wanted to report that to you, Mayor.
Thank you, Mr. Barrera. Open it up to the commission. I'm sure Commissioner Galansky has a couple questions.
Thanks. I was just wondering, because I'm not sure if it was already, do y'all still do the recycling over at the Southmost Community Center? And if so, what days or what hours? And what products do you allow?
Yes, we're still doing the recycling. I don't have that information in front of me. I can probably start looking through my computer really quickly to get that for you. I know I had provided some of that information over to Mr. Bernal, and worst case, what I can do is just send him an email and maybe he can get that over to you, but I can fulfill that information for you in a hard copy via email, if you will.
Thank you. And I have to say, so in my part of town, it's trash pickup is on Tuesdays, and y'all picked mine up early, and I haven't gotten any complaints today. So I think that's great, because I noticed a big change just as of 2 weeks from now. It's like considerable difference. So thank you.
Yes, ma'am.
I'm sure they're going to pick yours up early from now on.
Well, whatever.
Well, you know, one of the things I always tell my councils and all my council members in all my cities is, you know, we could run flawlessly, you know, like let's just say 365, 24/7, right? We would do it. You know, we We don't like to be down. We don't like to be behind. It's just not a good feeling, and it also costs us money, right? So I mean, at the end of the day, we try and be as efficient as we can, and we would totally do it. But the truth is, we're not infallible. I mean, we have a lot of things that occur in our business that'll either put us behind. I mean, some of the simplest things, I always bring these up, is like right now with the COVID situation, if a man is down, the next guy that goes in there doesn't exactly know the route 100%. It's expected call volume is going to go out. I mean, we see that when a guy goes on vacation, right? Goes on vacation in summertime, somebody fills in. We see that. So again, we would love to run 100% flawlessly. That's just not reality. But I'll tell you this, we do make every effort to face the music of whatever it is that we're facing here. And again, when we found out about the situation of 832 open tickets, I don't think that's ever happened. And that was just a very unique and unfortunate situation. But, you know, at the end of the day, we got it squared away within 48 hours. And we have no intention of that happening, because that's not pretty for us. You know, it really isn't. So.
And I will say, Mr. Rodriguez, I've been here for a year along with Commissioner Galansky and Commissioner Cowan, and I got my first complaint this week about you guys picking up trash early. That's a first. So I think you guys may have had to have gone back, or you know, the whole neighborhood was upset that y'all went early, which is the first. but I think you did go circle back, and I appreciate that. But thank you for being candid, being honest, and coming here to explain the situation to us.
Yes, sir. Yes, sir. Of course.
Anyone else? Okay. Thank you, sir.
Thank you all. Y'all have a wonderful evening. And if there's anything we can help you with, we're only a phone call away.
Thank you.
Y'all stay safe. God bless.
You
Bye-bye.
too.
Next, we have work session number 2, discussion regarding the City of Brownsville response to the urgent public necessity concerning COVID-19, otherwise known as coronavirus, included but not limited to continuity plan update, city staffing, facilities and services, including actions and continuity of such operations, financial update, emergency procurement, and drive-through collections testing site update.
Good evening, Honorable Mayor. I'll briefly go over the presentation that it's a standard presentations given before. We have the expenditure summary. Budgeted expenditures about $4 million. Non-budgeted expenditures total about $3.1 million. Total COVID-related expenditures about $7.1 million. Next page, please. Of the category that's not related to emergency, it totals about $6.3 million. The majority of it is related to personnel costs, about $5.9 million. Then you have your auxiliary expenditures there, supplies, leasing, contracts, other miscellaneous service and equipment. Next page, please. Further breakdown of personnel costs associated with base pay and emergency pay for emergency operations, and some overtime for other departments, total of $5.9 million. Next page, please. Further breakdown of personnel costs, which includes base pay and overtime distributed by departments. These are the departments that associated with them, from police department, fire department, mainly fire and PD are the ones that are the main expenditures on this side. And then you have some minor expenditures by other departments. Next page, please. This is emergency procurement. The only emergency procurement initially done was for PPE masks. Again, this is the only one so far. The bulk of it has been on the drive-through testing. The drive-through testing has been part of the emergency breakdown. It's broken up into 2 figures. One is the medical staff associated with the drive-through testing. It's about 200,000. And the testing kits, this comprised of uninsured, of testings of about just over $600,000. Next, this spreadsheet, we added it last meeting. We have actuals totals on here. Totals actual spent about $7.1 million. What we did is we provided a projected estimate, just the rough numbers, just so we could get a guide ourselves on what type of expenditures we're expending. And but to date, we've actually have unallocated amount or unspent amount of about $3.2 million. Next page. Again, reimbursement strategy. Again, what is the organizational needs? Financial sustainability, cover some of our operational expenses as best we can. Teleworking, facilities, retrofitting, public communications through our communications and marketing department to provide information to the public on COVID-related announcements. Equipment and supplies, PPE supplies, equipment, items of that sort. To be determined, childcare, that's one of the items that is tentatively being surveyed since schools are not going to be back in session. One of the items that we're going to be looking at is providing some type of childcare services, depending on the need of the city department, trying to find out, see what the need of the employees are in that respect. Under community needs, of course, we initially had the drive-through testing where phase 2 is the testing expansion, which I believe we have 2 or 3 extra sites we've expanded to. We're also going to be making an application software purchase to consolidate the tracking of these testings and updating that in one consolidated software. On the business side, partnering up with BCIC and UTRGV on e-commerce training, training our local vendors and adapting to the changes of COVID. Partnering with CSC on disinfecting cores. Also, one of the items that has been talked about is to be determined yet is one of the items is a micro loan program, something for consideration. Next page. That concludes the presentation. Have any questions?
Lupe, if I may, and maybe Art or Odie can answer this, but on the drive-through testing, the individuals that may want to test the second time, can you clarify how that is done? Because my understanding is that the city pays for one test, and then if the employer is requiring a second test or a negative, et cetera, then the individual will pay for that on their own, or the employer will pay. I just want to make sure the city's not paying for subsequent tests. I just want to make sure of that.
So this is Odie. So actually, Cameron County Public Health is issuing clearance letters to people who have been tested, and they can use that to return to work.
Okay, but that wasn't actually what I was asking. I just want to make sure the city's not testing for subsequent testing for individuals that may need it for work, because that's, I mean, me personally, I don't think we should be doing that. I really want to try and focus on finding those that are not positive yet, or those that need to test to determine whether or not they're positive. But have we been doing secondary tests?
Honorable Mayor, Commissioners, this is Art. There was a point in time when some did get through the system, but as of the early part of July, it's something we caught was occurring, and we've worked very hard so that is not occurring anymore.
Okay, thanks, Art.
Yes, sir.
And then also, Lupe, I've seen that 29,750 PPE number for the last 4 months almost. Are we just not getting any more PPE, or what's going on? Are we getting it through other means? What's happening?
Just to clarify, the reason that was on there is because it was an emerging purchases that exceeded that. But as far as PPE supplies, we are working with Internal Services Department to continue. We're not able to order in bulk orders because it's been very hard to find those orders. So we've been incrementally procuring those PPE supplies, especially face masks, gowns, medical gowns, coveralls. Those items have been very hard to locate. But as we locate those items, we have been making sure that we do those incremental purchases so we can make sure that we have inventory in stock. And that's something that we continue to do, and working with Internal Services to reach a target inventory. Our inventory is not to where we want it to be, but that's where we're working towards.
Okay, so then where would the PPE expenses show up then?
That would be part of the supplies portion.
Yeah, I just want to make sure number one, I want to make sure we've got plenty, but then second, I just want to know that the expense is being tracked.
Yeah, on slide number 2, they would be under supplies, part of the 300,000. Slide number 2.
Okay.
Um,
On the supplies
Art-
portion right there?
Yes,
Okay. Commissioner Gowan, were you
Is-
gonna ask?
I just had a brief question. So is TML arranging any kind of bulk purchasing ability for cities? Maybe in collaboration with the Texas Medical Association? I know TMA has a program ongoing.
in regards to PPE or in regards to testing?
In regards to PPE.
I was not aware of something like that. We definitely make some inquiries on that.
Yeah, I find it hard to believe that there isn't any sort of existing programs where municipalities or emergency departments or counties have access to this that's prioritized over other entities or other providers. So I'm pretty sure there's some sort of resource out there. You just got to look for it.
That's why I was asking. Maybe Dr. Wells can contact the Texas Medical Association. I know there is a program for individual physicians. So anyway, just a thought, something to check on.
Yeah, this is
I do
Chief
know-
Sheldon. We are getting PPE medical supplies through the HPP, the Hospital Preparedness Program, and through EMTF and through Cameron County, the state. Our medical supplies, as far as the PPE, is pretty healthy for the fire department right now in responding to that. So we do have a partnership, and we are creating that stockpile here locally through that program, and that's where we're getting a lot of our PPE. Plus, we're still ordering through our own vendors that we have contracts with.
Thanks, Chief.
Mayor and Commissioners, I also wanted to add, we recently had also donations from our local Walmart, and those donations we're passing them directly to the nursing homes, so that we're also making PPE available to our local nursing homes as we get those donations from Walmart. Thank you.
Thanks.
May I ask a question?
Sure.
Lupe Granado, do you have like any sort of data as to how much maybe the cost per test has gone up now that we have 3 sites, or if it's gone down versus like the cost to the city, what it was before per test?
The cost is a contracted amount of $110. That amount has not changed. It's set by contract.
What we have seen, though, Commissioner, is we've kind of seen a reversal of insured versus uninsured. At the beginning, we were seeing almost 60% of individuals were insured. And then now we're seeing that I believe it's 57%, the last I checked, is now uninsured. So we are expending more for those individuals that are uninsured, from 40% maybe to 40 to 57. So it's almost like a 17% turnaround. So we are incurring more expenses to cover those that are uninsured.
And none of the labs, unfortunately, will give us a price break for volume. And I asked, I know Art did as well on many occasions, they won't cut the price any lower than that per sample.
So is the difference between the demand and supply of testing getting smaller? Because I think I read in one of Odie's reports recently that they were testing about 400 people a day, but then there's about a demand of 700 tests per day. Is that narrowing or?
So we're
Go ahead, Art. No, you go.
Thank you. So what we're doing is we meet the demand by scheduling people as soon as we can within 24 hours now. There are some people that don't show up to the test, so there's no cost for that. The actual encumbrance we have is for people who actually test. Now the breakdown for that will be whether they're insured or uninsured. And as the mayor correctly stated, we're running about a 43 to 57% breakdown of insured to uninsured. So not only as we get more people being tested per day, which we're at about 100, 400 per day, give or take, and we are getting more uninsured, you will see an increase in the cost to us. But it's not that the rate went up, it's that we're testing more people and more people coming to us are uninsured than we previously had.
Right.
And I'm just curious, is it a matter though of finding out what the sweet spot is in terms of how many tests should be done for each site to make each site, you know, break even or not? But I guess it's just money going out. So
Yeah, so what we're doing is we tested the software today, Schedulo, and really what we're going for is giving our residents access to testing. So as residents are signing up to be testing, we're trying to get them to their closest testing center, which is a priority, so that we're not a barrier to testing, but rather we're facilitating that the citizen can get their first test through us.
Prior to this time, the biggest problem we had was just capacity and the fact that people were waiting a week, sometimes longer, just to get an appointment to go get tested. So the appointment within 24 hours because we have better capacity. But all sites, as Art was saying, take both insurance and non-insurance. So we're not identifying one particular site as just for insurance or just for uninsured. The cost and the randomness really depends on the person's what's more convenient for them and all of that.
And correct me if I'm wrong, Art, but I think we're the only municipality that's running its own drive-through, at least in the Valley for sure. I don't even know any other, I don't know the other cities in Texas that are doing it, but this is a huge initiative. We've tested now about 11,000 people, or we've done about 11,000 tests, which is amazing and really speaks to the commission's commitment to taking care of its citizens, but also just identifying those that are sick. If we hadn't done this, I think we'd be way worse than we are. So it's been a huge initiative and definitely a collaboration of different entities and a logistical nightmare sometimes, but just logistically, it's been a real positive.
So that is a correct statement, Mayor. Just today I met with Cameron County and the other sites in the Rio Grande Valley that are testing, those sites are tested through the military. And they only have a certain amount of tests that they do. I believe the max is 200 per day.
I'm not.
I have a quick question. Which entity is billing the insurance companies here? Is it the clinic or the lab or the city?
I'm going to have to confirm that, but it's my understanding it's through the laboratories.
Okay.
I think that depends on the facility, John, because the providers are billing for their services, and I think the labs are billing also for their services. I just don't know whether the labs are billing the provider directly or they're billing the city. That's one issue, but both the providers and the labs are getting paid for their services.
Okay.
I think the other important point to make is that not only are we the only city doing all this testing, but we're also the only city that's actually not just testing you, but connecting you to a healthcare provider. And in our area, we know that healthcare access is very poor. So the cost that we pay includes the test as well as at least that connection to the provider. And in the case, in these people's cases, when they're sick, that's really invaluable. And I think that is really, we as a commission should really be commended by that, and as well as administration.
And I agree. I've had a lot of feedback from people in other cities who send messages and ask, can I go get tested there too? Because I can't find testing here in my city. And it's just a great resource for the people of Brownsville. And I just hope they really appreciate that anybody that lives here has access to it. And that's not something you find anywhere else. So again, I commend the commission and I thank everybody for being so proactive, whether it's testing, whether it's masks, whatnot. I really feel that the city of Brownsville has really done their best to make sure that we're ahead of the game as much as we can be. And it's proven that it's more than other cities that are smaller than us who are having bigger problems than the situation we're in.
Well, we've got 3 facilities now. I think we're going to get a 4th online here at the end of the week or sooner. And then maybe we can start looking at possibly a mobile testing unit as well for some of the areas where citizens may not have transportation to be able to get tested.
That's great. That's really great.
All right. Thank you.
So Honorable Mayor, Commissioners, good evening. Tonight's presentation is a little bit different because we now are presenting on 3 facilities, and we wanted to give you some holistic numbers of the COVID-19 drive-through testing sites, totals as of July 16. We've administered over 69,603 tests. When you break those down, you're breaking down a 45% insured to 55% uninsured. And to date, we've reported 1,816 positives from the latest through, and 6,100 in negative results. There was a question earlier today about the number of results pending, and there are several reasons for that. In some cases, the labs will run into snags and they'll go up to 7 days. We did have an issue with the Port Clinic through LabCorp where their testing samples took almost 12 days. We did reach out to those individuals and are asking them to come back and retest because it was out of our control what happened through LabCorp, but we wanted to get those results back to those individuals. So this is not the first time it happened. It did occur to us. We had one with UTRGV recently as well. So we were realizing that labs have situations occur within their purview, but our priority has been to get those results to the individuals as quickly as possible because we realize they have decisions to make based on and treatment to receive. And if they're waiting for test results beyond the number of days, it almost becomes a null value to know whether you're positive or negative.
Dr. Rodriguez, I want to point out a couple things. It looks like these totals are a few days old. It says July 16th, but then more importantly, it shows 69,000 tests. That's not right.
You are correct. It's 9,600 tests.
But that was as of a few days ago. I know it's over 11,000 now because I saw the most recent numbers. And then there's over 2,000 results pending.
So as of today, the latest that we read is 11,133. The latest percentage is 43 to 57%. Yesterday, we had 69 positives reported and 183 negatives reported. And I did report this morning 2,548 samples pending. When we submit these slides, it's ahead of time on Friday. So that's why you see in the discrepancy what I reported this morning on the hospital call versus these numbers here today. Next slide. So our locations for the COVID-19 drive-through, the sports park came on board on March 25th, and to date, they've tested 8,567. The Port Clinic located on Highway 48, July 7th, 2020, they've tested 1,016. And then the Reliable Clinic located at the Old Brownsville Doctors site came on board on July 15th. And as of Friday, they had tested 20, but they've come on board now and their latest numbers are they've tested 437 since that number, since we give you that number, because they did their days of operations are Monday, Wednesday, Friday, Saturday, and Sunday. And when we put this report, they had only been in operation one day. Mm-hmm. Next slide. So I'll let Ms. Jones give us the latest case counts related to COVID-19.
Before you do that, can I ask a question?
Yes,
I haven't checked BTX Cares in a few days, but I think we should let the public know the sites and the hours that we have available, even without them having to go in and fill out the questionnaire, just so they get an idea ahead of time of what those hours and days are like.
So that's a great question, and I want to answer it. We actually addressed that earlier today with the Schedulo module. It actually will only allow you to schedule for the hours that drive-through is in operations. So when you go in and self-do the schedule, it will give you the hours, the time, and the location that's closest to you.
Okay, so they'll see it in that program.
Yes, it will actually be burned into the actual time they get to choose. It'll give them a limit as to what are the hours that that specific drive-through has for that location.
Okay, great.
Yes, ma'am. Thank you.
All right, so this right here is our daily case counts, and this is up to July 16th. And as you can see, I've included some of the major events that we would see from the executive orders for reopening, graduations, face masks. And as you can see, we are steadily seeing that increase. That's also being played out in some of the other data that we're seeing. But with each one of the reopenings, we do see that bounce and a bounce again. And it's right at that 14 days, as you can see, as we're climbing up. Next slide. And we broke it down this time because some of the other statistics were getting smaller, so that it was more difficult to see. So we've broken it down into the confirmed cases by age group. And as we've seen the last probably 4 weeks, overwhelmingly, the 20 to 29-year-olds are really the driver of what we're seeing in confirmed cases in the city. Next slide. And then this is our fatalities by age groups. And as the reports have all been coming out, it is overwhelmingly geared towards the 80-year-olds and older. And those tend to be our most vulnerable populations, not only because of age, but also due to the existence of comorbidities within those. But the 60 and 69-year-olds are actually increasing a little more rapidly on this slide. So that's something that we also need to be aware of as we're moving forward. Next slide. And this is our positivity rate at the sports park. I don't have complete data on the Reliable and the Port Clinic yet. And if I added some of their positivity rates, it would skew our data. So I just wanted to stick with the sports park for now. And this is up to the July 3rd. And we are seeing that increased positivity rate. It's up into the upper 30s. And even with the preliminary data on some of the dates that came in through the weekend, it's still at that elevated level. And our preliminary information that we're seeing from some of the others are also in line with that amount. So I would say consistently, probably above 35%, but still under the 40%, which is really concerning because that shows us that we're having widespread community transmission. Next slide, please.
Hold on. Those numbers are 2 weeks old. Do we have any idea where we are now?
Yeah, we're at almost the same point. This weekend we got a bunch of positives that came in, but these slides were submitted on Friday. But we're in the exact same positivity rate. We haven't decreased. We're still holding. Well, we might have. I think we decreased like 0.5%. So, but it's still holding steady because like I said, some of the preliminary data coming from the Port and from Reliable are still up in that 38-ish range. So we're still holding strong right there at that level. And then next slide. And this right here, I remember the last commission meeting, Commissioner Tetro had asked if there was some way to track cell phones. And any of that information for personal information, but to see if there's a movement and if there's any correlation between movement in our cases. And it was like clockwork. UT actually was able to locate that and present it as a report for us, specifically for Brownsville. And this is all de-identified information, so it's not like we know who these individuals are, but we are seeing that they are leaving their homes and how their activity is moving. And if you notice, and this is from the first of the year, we do see with each one of the mitigation strategies that are implemented, we see some of the decreases. And then when we're seeing the reopening, we're seeing those increases, and it's going along with the increase in our cases also. And that's what that red line is new cases. And keep in mind, we've discussed before that it's right around 6 days before symptom onset, and that's being shown out as we're seeing the increase in activity and movement within the city. It is almost exactly 6 days we start seeing some more of those positivities coming in those new cases. So it's kind of informative as to how our actions and how we move about are actually impacting individuals around us, and specifically some of those more vulnerable populations that we saw with our case fatalities. All right, next slide, please. Oh, and did you want to?
Yeah, the other thing I want to add, Honorable Mayor, Commissioners, are we've also been tracking the activities of nursing homes, and we've documented a form now since we keep coming back to the same questions being asked, family members not being kept up to date, the frequency that they're testing residents and employees. So I just wanted to give you the latest. We've actually developed an internal tool that we are now sending out through the nurse we recently hired, so that we can start to follow the CDC guidelines and share that as we get calls regarding nursing homes in Brownsville, Alta Vista, Brownsville Nursing and Rehab, Ebony Lake, Fox Hollow, the Senior Care Center at Valley Grande and Spanish Meadows. We're beginning to track that, and you're going to see us coming back with some graphs showing the activities that we've been highlighting there. I do want to say that we continue to renew the orders. Ms. Ori Leal today assisted us in renewing 2 orders against Fox Hollow and Alta Vista nursing homes because we continue to see positive cases of residents going on there. And the next presentation that you see from us will include some more specific data that we'll be reporting on. And in addition, there's been questions on the funeral homes. We're reaching out to the funeral home directors and see if they would like to join us through the BTX Cares and do a Zoom call to answer some of the citizens' questions and concerns. One of the things we did find is that not only is it the funeral home, but the cemetery that's also an issue. So there's many moving parts to the process of and we really want to communicate that out to the public so that the funeral directors have an opportunity to come out and explain to the citizens of Brownsville what is the process and why is it that someone's death may take as long as 2 weeks to get from the point that they're notified to the point that they're buried at a local cemetery. Thank you.
I really appreciate that, Art. This weekend, I received a phone call from an elderly woman whose husband had passed away. And it was so moving. I was crying myself with her to hear how she was unable to get her husband into a funeral home because of the amount of deaths that were piling up. And so I'm so grateful to the city of Brownsville. I know it's something that a lot of people don't really want to hear about, the situation that's happening with the funeral homes, but I feel it's so important to give them a voice and give them a way to express to the community the reality of the situation, because while most people recover from COVID, we're learning very quickly that people who are elderly and people who have health complications are not making it out of those hospitals. And I never thought we would be in this situation, but I feel like it is so important to give those funeral directors a platform at the city to be able to communicate with the public of the reality of what they will have to go through if they have a loved one pass right now during these times.
Yes, ma'am. It's very, very true. In addition, I need to add, we're also going to be at the next meeting, we're also going to be working with the city secretary's office to present some of the vital statistics data that comes in for deaths reported. I have to say a disclaimer, it is not public health data, but it is vital statistics data. And while it may come from 2 different fountains of information, I think that what we're chasing here is we want to be as transparent as we can. And even if the county health department is running behind and not able to report the latest numbers, we are very fortunate that through our vital statistics, we can at least report what are the cases and the age demographics and the genders and some of those demographics, so that at least the public can be preempted to what may be coming down the public health pipe.
And again, Art, I really appreciate that you're doing that and taking that extra step. I know that right now the county has something like 25 deaths in Brownsville reported, when I can tell you there's probably been alone 3 times that amount just on our Facebook feeds. And so it's very important, very extremely important that the people of Brownsville understand the reality of what's going on. And I know the county is behind. Is there any way, or has the city ever offered to help them? Maybe just, I mean, the people of Brownsville are so important and they need to know the reality and day-to-day of what's going on. Is there any way that maybe the city can supply staff to help the county report those numbers just for the city of Brownsville? Have we offered to help them? Have we offered any staff or any funding?
Yes, ma'am. So the
It's
school
my,
public health and the Texas Department of State Health Services has a tracer program. But the city itself, our department has reached out to them. In fact, we have an MOU right now that legal is reviewing so that we can begin to some of that process. But the school public health has been sending some students in their way to try and assist them. Just keep in mind that the tracing program, which Dr. McCormick has said right now is so widespread in our community that right now we need to shift to containment, that as long as we can reshift our this is an operation, and if we can shift to containment, we can try and bring the positivity rate down. As the positivity rate comes back down, we're able to get back to the tracing side and then try and contain this again, which is part of the reason we've been messaging through the threat matrix at a level 4, because until we're at a level 3 and we can contain and know whether the case is our community or from a previous investigation or travel, it just is on the shoulders of our citizens to wear their masks and try and social distance, because we can't get around this. Those are the measures that help to control this COVID outbreak, is hand washing, wearing a face mask, and socially distancing, and trying to remain home as much as possible. Thank you.
I appreciate that. And I'm glad. I just want the public to know that we are aware that they are almost 3 weeks behind. So the numbers that are coming out daily is not the reality of what's happening. And the amount of people that you think have passed is probably quadruple, maybe even 5 times that amount. And so I'm just very grateful. And I really want the public to know that the city of Brownsville is here and you are here, making sure that we do everything within our power and have every resource available to assist the public during these times, and to keep wearing their mask and washing their hands, and don't leave home if you don't have to, and make sure that you call your parents and tell them whatever you have to say, whether it's nice or not, but they should not be leaving their houses, because I know a lot of them are not listening right now, but they really need to.
Thank you for your ongoing support.
Thank you.
Thank you, Dr. Rodriguez.
Yes, sir.
Next, we have work session number 3, presentation on the proposed fiscal year 2021 budget.
Good evening, Mayor, City Commissioners. The Finance Department, along with various departments, assisted the City Manager's Office in the budget process. This is budget work session number 2. Next page, please. Table of contents. We have table of contents items that we're going to be covering. Starts with general fund highlighted revenues, expenditures, non-recurring expenditures on here. 2021 inflection points, other fund revenue expenditures, and then OPEB discussion. On the general fund, one of the items that the city is striving to is to make sure that we have a sustainable budget, making sure that we follow the financial forecast. Part of the financial forecast, part of the budget was to set some guidance, some ground rules so that we could follow. One of the main items that part of the financial forecast is making sure, trying to focus our budget reoccurring expenditures. You have two types: reoccurring and non-reoccurring. Reoccurring are the type of expenditures that are part of our service levels, that are going to be year over year, and want to make sure that we're able to fund those through reoccurring expenditures. Case in point, property tax, either through property taxes, that's the main one, and through sales taxes. Those are the, and part of the financial forecast is focusing on those two revenues to make sure that we're able to substantiate our reoccurring expenditures. Tentatively, some of the highlights for property taxes right now, even though we haven't gotten the certified tax rolls, preliminary numbers, which shows about just above a 5% increase of property taxes to $32.8 million. This number will be more evident once we have the certified tax roll. The other item that on here is the sales tax. We show a preliminary decrease of about 15.4% This number is a number that we worked with a consultant to verify this information. We provided our own projections and worked with a consultant to look at the sales tax, and I'll go a little bit more over this. Another revenue highlight is a SAFER grant. This grant will help offset the initial years to fund 15 firefighters for the general fund. Again, it's a matching grant which will provide it for the first 3 years. And then on the continuing with the financial forecast parameters, policies, again, not relying on the enterprise funds, PUB, landfill, and bridge, having those revenues set so that we're not committing any additional of these revenues for reoccurring costs. Any amounts above these would be used to cover any non-reoccurring expenses. Next slide, please. On the property taxes, right now, what we show, right now we have, because of SB2, we have a cap of $3.5 million, excuse me, 3.5%. That brings us a growth of about $1.6 million. I know sometime in previous commission meetings, we anticipated with the COVID pandemic that we could possibly go over the cap if it was needed. And one of the items that's on here is the revenue growth that we have so far, just meeting with the 3.5 cap will give us about $1.6 million. Revenue increases, one of the revenue increases, well, what does 1 penny do to our revenues? It's about $674,000 a revenue either increases or decreases your budget availability. Similar, half a penny, it's about half of that, about $337,000. One of the recommendations that we have is, as part of the budget process, is to include a Sunday service pilot program. This is about $412,000 on here. Next slide. The growth trend analysis. This is you remember this is a similar. This is the actual growth analysis. The blue line represents the growth from existing properties, and the yellow line actually shows very stable, very nominal increases from new commercial, new properties. Now, one of the items that similar to last year, that we were able to provide for added items in our recurring budget was because we had an unusual higher valuation that dealt more with commercial property. This year, we had projected about 3.5. The amount of the increase for this year is going to be between 3.5 and 4.5% on the valuation. This 1% growth is about $500,000 in taxable values. That's something that that's for consideration should the city is in need and able to go above the 3.5% cap. That is something that will be for consideration during the budget process. Next slide, please. On the sales tax estimates, we projected a decline about 15%, or about $4.7 million compared to the fiscal year 20 budget. Next slide, please. What we did is we worked with a consultant and provided make some analytical data projections that is before you. This is actual city sales tax collections from calendar year 2000 to 2020. This is actual data, and this is what it is year over year, sales tax collections. This actually shows the first dip on there were the 30,455. This actually is reflected of the Great Recession that we had during this period of time. The city took about 5 years and 10 months to come out of that recession period. one of the, and this is the only metric that we could compare to. The green section is a projection, is what we call the what if scenario. The what is the worst case scenario based on the data, based on the analysis is, how long will the city take to get out of this recession? One of the items, it's about 4 years that we anticipate that to come out the recession, but this is just based on cumulative data that's month to month. And this is something that we have a system in place so that we can continue monitoring to see to what scenario it will apply to. Next slide, please. In summary, using a base case scenario will take us about 4 years to come out of this sales tax decline. Total out of the 4 years, about $19.8 million. For the first year in 2021, on this particular scenario, it actually projected about 16.3% decrease, or about $6.5 million. On the best case scenario, it shows that by fiscal year 2021, we'll actually have an increase. So we're using the worst case scenario because we just don't know what we have to work with. Next slide, please. This is a similar scenario. Instead of on the green section, instead of taking about 4 years, it'll take about 1.7 months, 1 year, 7 months to recover on the best case scenario. And these are just scenarios that we're running. And as we go through the next few months, we'll have a better understanding, better indication of where our sales tax is going to be.
So, Lupe, and just to briefly interject, Mayor and Commission, good evening. This is an important assessment because this is all those lines, they all mean something. There's a lot of regression analysis and standard deviation and sensitivity tables. And we didn't want to go into the complications that go with that. But to Lupe's point, the only reference point we really have on how to adjust for sales tax, which is typically the most impacted revenue source when it comes to the economic cycles that we face, is the Great Recession. We haven't, as we've discussed, there hasn't been a pandemic. You're not going to see a pandemic on this chart. Sales tax wasn't around 100 years ago. So this is a way to measure the breadth and the depth of what we could potentially face. And what you see with that hole, it creates a cavity. And that pretty much shows the depth of what the unrealized revenues from sales tax could potentially be. So in reality, from a financial recovery standpoint, we're just facing the tip of the iceberg. So this is going to be a multi-year recovery effort across sectors. But for us, financially speaking, that is why the concept and the theme of the inflection point is what we've used, because the question is, what are we beginning to do now, and using fiscal 21 as an opportunity to start to shift how we deliver service so that we can maintain a structurally sound and balanced budget throughout, and then reemerge whenever the recovery really hits, a stronger organization. But we're trying to preserve our employees, maintain our services and programs wherever possible, and then really taking that heart-to-heart look at what do we do well, what do we not do so well, what is our core mission as a city, and what are the services that we feel that we can deliver even under the recovery that we're going to face, so that we can adjust as needed, because this is going to be a multi-year process. We're just getting into the beginning of the financial recovery. No one has a crystal ball. This is just a way at trying to provide some basis for how we're going to have to approach our financial planning long term.
Next slide, please. Few general fund highlight expenditures. Sunday service pilot program for $412,000. Personnel costs, we have a contract commitments with our unions, police and fire, safer grant expenditures, and the full implementation of phase 2 of the compensation study, and also transfers out to other funds about 6.3. Total expenditures $110.3 million.
Lupe, may I interrupt you? What's a Sunday service pilot program? Because I looked it up and I don't think it's what Yeah, what is that? Is it?
For bus.
Oh, really? Oh, okay, then it is.
One
Dang,
of the,
we need to add more hours though during the weekdays before we add Sunday, but okay. Sure.
So Meredith, good point, and that's why it's a pilot program. If you recall, last year or sometime in the fall, Norma presented the study that was performed. There was a survey and data was acquired. There's going to be some additional analysis, which is why this is a pilot, because whether this is the best route to offer or it should be more hours during the week, it's going to be assessed in parallel. And whatever the long-term commitment needs to be, whether it's Sunday or, to your point, weekly hours, we're going to find that out. So we're calling that a pilot because it gives us a good 1 year time frame to gather data and make that decision in a more informed way.
This schedule provides a little bit more detail on the different expenditure categories. You start off with your adopted budget, the budget that the way it was adopted. These are the fiscal year 21 commitments or reductions. These are commitments that in order to provide the service levels is unavoidable expenditures that need to be added to the budget unless other things need to be adjusted. And then your proposed fiscal year 21 proposed budget for fiscal year 21. First one you see there is personnel services, about $1.1 million. Briefly went over that previous slide. On miscellaneous, next item on there, the miscellaneous service contract. This has to do with the initial marketing and communication department. Initially, when the budget was set up, the initial budget did not have all the operating assistance operating budget that was required for its operation. It's not reflected on there. On the special projects, we have, hold on, got my notes on there. On special projects, we have a decrease of about 53,000. This is in reflections. We opened up a new TERS fund. If you see further down the line, we used to take care of all the TERS commitments coming out of the general fund. What we did is we opened up a new fund so that we could take care of those commitments out of a different funding source, so we could account for them differently. There was also some expenditures on there relating to county collection fees, appraisal district fees, brought a negative decrease to the special projects. On utilities, this is an increase to the services at the zoo. There's an increase in utility consumption at the zoos that needed some increase to the budget. You have the pilot project on there, the 412,000, and then the rest of them are listed, transfers out. Like I said, we set up a fund for TERS number 1, TERS number 3, a combination of 215,000. On the airport and on the public transit, you'll see decreases on here. The reasons because of the decreases, we had some CARES funding that's going to carry the operational costs for the next year or so on some of these on some of the program year. On the sports park, you'll see a reflective of 291,000. This is in conjunction to limited revenues projected on the sports park, and there was initially some naming rights that were budgeted on here. Those items are on hold for right now, so that's why if operations of the sports park will increase on there. Performing arts is in operation of Stegman building. This will be an annual commitment of the city. And that sums up that total expenditures on there. You'll see total budget expenditure $110,300,000. Next slide.
So real quick, Lupe, if I may, on that slide, Mayor, Commission, if you look at that 101.9 million, Lupe mentioned how the 3.5% provides for 1.6 million. So the difference is pretty much the Sunday service. So there would have to be an adjustment or an increase slightly over that 3.5% to enable the Sunday service to happen. So it's here because it's recommended, but it can be removed and we can just have a flat 1.6, which is in line with the 3.5% cap. The 1.6, as Lupe showed in the prior slide to this, pretty much covers these recurring commitments. There's the permanent salary increases that were given last year, all the things that Lupe just described. I mean, basically, this would be the more straightforward kind of basic budget that allows us to meet our needs and maintain a structurally balanced budget going forward by not adding any new recurring costs that are not supported by recurring revenues.
Proposed balanced budget that we have total expenditures of $110 million, revenues of 103. The difference, as we know, CARES funding, some of the CARES funding that we're gonna be reimbursing ourselves for some of the COVID activities. We're gonna be utilizing that as a sales tax contingency to hold us to mitigate the reduction in sales tax. So for fiscal year 2021. Also, in conjunction with that, we're implementing a hiring freeze, a strict hiring freeze that will save us some salary savings in about $3 million. With these, we are going to be proposing this balanced budget with these factors. Went over recurring, non-recurring revenues. These are the different categories. We have regular recurring revenues and non-recurring revenues. Some of the non-recurring revenues that we have as per financial forecast, we've through the budget process, through the PUB transfer, we've budgeted very conservatively year over year. We've actually had excess money coming from PUB. Part of the financial forecast is instead of that extra additional revenue above the $9.5 million, instead of going to cover recurring costs, what we're asking, what we're going to be doing on this one is dedicating it towards the funding of the target of the 90-day fund balance. Part of the financial forecast is we are wanting to reach the 90-day fund balance in our general fund. And what we're proposing on this is to have any excess monies from PUB transfer for fiscal year 20 to go towards the fund balance. And also another non-recurring revenue, the city has always recognized sales tax revenue in a 12-month increment, but we've always done it through the month of August because the money's collected in the month of October. We go ahead and do the full accrual, but there has been an opportunity to do a full accrual of expenditures. In other words, sales tax monies that were received in September, but received in November, but it pertained to the month of September, we would always record them in next fiscal year. Through this accounting principle change, we are proposing that revenue be reflected in the correct period in which the sales tax is actually earned in the month of August instead of in the month of October. This amount will give us an amount of about $2.1 million of revenue. Next slide, please. And this $2.1 million. These are non-reoccurring expenditures. These is one-time sales tax accounting transaction, and some of the items that we're proposing to do with this non-reoccurring revenue as technology projects. We'll go in depth on that one a little in the slides coming up. Elections that are coming up, about $350,000. Mobility plan, $300,000. There's a grant, a 50-50 grant with CDBG for historic preservation program of $250,000. We have a new codes implementation, impact fees, and fire CPMS, total of $375,000. COVID hotline, $137,000. Extra bus line match for $54,000, and other non-reoccurring expenditures. Those non-reoccurring expenditures, the bulk of it has to do with the shade structure at the BARC construction, development meet and greet, new employee reward recognition programs, and annual hurricane awareness programs on there makes up the $49,000.
So, Mayor, if I may, before I know there's more slides, but basically the non-recurring revenue, as Lupe covered, the recurring revenue doesn't provide a lot of wiggle room to accomplish some of the commission objectives, some of the strategic planning or strategic vision items. Some of the things that are here are things that can begin to impact the organization, going back to adjusting over the long term, and needs that we've expressed to the commission, whether it's redevelopment, whether it's preparing for the implementation of the Unified Development Code and changes to our ordinances, et cetera, but essentially these are one-time projects that are going to enable us, particularly things like technology, that are going to help us start to shift the organization as we look at a post-COVID-19 environment. So we're fortunate that because of the sales tax adjustment, we're able to have this available funding that we would suggest that we do a host of these different initiatives in fiscal year 21. Next slide, please.
This slide represents the reoccurring, non-reoccurring revenues and expenditures. Separating out the revenues from non-reoccurring revenues, whether it be revenues or expenditures. The first portion on here, you see revenues, total reoccurring revenues of about $104 million. We separated out the non-reoccurring revenues, which are related to the PUB actual transfer over budget. Those are, we don't want to account for that as part of reoccurring revenues of about $1.3 million. The sales tax accrual that I just mentioned, about $2.1 million. And this is a sales tax contingency regarding the COVID reimbursement that we're going to be getting to balance our sales tax, about $3.9 million. Total revenues about $110,687,000. Next slide, please. Similar breakdown that's breaking down the expenditures. You have recurring expenditures year over year, non-reoccurring expenditures that we just went over about $2.1 million. Hiring free savings about $3 million. We have total expenditures of $109 million. Change in fund balance relating to the PUB 1.3. We have unassigned fund balance of about $25.4 million. This represents about 84% of the targeted 90-day fund balance requirement. So in one of the proposals that we're doing, instead of meeting the 90-day fund balance requirement over 1 year, we're proposing to have it over a 2-year period. So that gives us an opportunity to do some of the projects that are needed for the city to undertake.
So Mayor and Commission members, what this spreadsheet does is it pretty much captures that methodology that we went into depth during the financial forecasting work that we sought to explain better how recurring expenditures and revenues work versus non-recurring. So this is the interplay of recurring and non-recurring revenues, just to show you all that, we maintain a fiscally sustained, structurally balanced budget by meeting our $1.6 million of financial commitments that we must fund, and how we're sustaining ourselves going into the next year, and even being able to fund our fund balance, because as you all recall, we capped the enterprise fund transfers from landfill, bridge, and PUB into the general fund. So that $1.3 million, because we created that system, every year as we budget, there should be a surplus that we're going to first dedicate to the fund balance, and over time that becomes available for cash funding of capital outlay and different types of one-time projects. We're not recommending that we take that sales tax accrual money to fill up the 1.7 million, because we would want to have some availability of funds to begin to forge forward on some strategic initiatives, which I'll begin to expand upon in the next few slides. Next slide, please. So this is where we left off after the first budget workshop. And I think this is where the reality is that states, municipalities, even our federal government, there's going to be a lot of strategy needed, a lot of leadership needed to move forward. We understand that we've been fortunate to receive CARES funding from FTA, FAA, and the CARES fund, which has helped our general fund. But our strategy will not and cannot be, let's just rely on the government to bail us out, so to speak. We need to be more self-sufficient and make permanent adjustments and adaptations to the new normal. So we need to grow our way out of it. We need to innovate our way out of it. We need to modernize as an organization. In the private sector, you're seeing more companies adopt digital service and workplace. Digital services is what the workplace has adopted. So that's a lot of what we need to also do. We're no different. We need to make similar adjustments. So we talked about being more agile, being more resilient, being more data-driven, knowing our inner workings a lot more, so that we allocate resources more strategically. If there are ways that we need to eliminate or redeploy how we deliver service, that should also be on the table. And then also the philosophy that we've started to implement last year, like reducing the general fund, the bridge fund transfers, creating cash funding mechanisms, that type of thing. And then of course, investing in technology and outdated equipment. You know, all those are things that we need to do so that we can shift and come out of this strong as an organization. Next, please. So the theme that we've used is Renew, Reimagine. We've incorporated on that technology item that you saw on the one-time projects, what we call our strategic automation plan. This is really one drop in the bucket compared to a lot more that we can do. We're ripe for a lot of efficiencies and improvements. We also have some suggestions that we would need your direction on how we want to reevaluate certain services that we provide, whether we can still afford to subsidize those, or if we have other more basic needs that we need to provide and shift toward. Luba talked about how we're going to assess our fire department and seek to use some of the data that we have within that department to become more data-driven and not rely on national standards, guidelines, and benchmarks. And then last year, we started shifting our public information service department, which is where the library lives. And we had a lot of technology work and communications work kind of commingled into that department. And last year, we began to apportion that into the proper department. So some of that went to technology, some of it went to communications as that department was created. And there's some additional work that's being done within that area that we want to reassess. And then during the course of the fiscal year, you saw the $3 million of savings through the freezes. We really want to look at all positions, and we may look different as an organization in 2022 and beyond. Next, please. So this is a portfolio of suggested automation improvements. Some of this would come from our capital improvement program because it's too expensive to fund even from the one-time $2.1 million. But we're looking at enhancing, there's a whole set of modules that planning and development could implement. We're just focused on one that is cost effective and has the most ROI for the continued process improvements that we need in that department. Internal services is a new department for us. Before we start hiring, more individuals, we want to first build a more digital type of department. So there are computerized maintenance management system options that work really, really well. Think of an employee walking around with an iPad, looking at data, looking at energy consumption, and all these different ways to better manage our facilities and be better stewards of our infrastructure assets. Digital parking solutions is also on the table. We have a need there as well in how we manage that service. On the finance side, there is an artificial intelligence software that we're looking at that helps automate invoice processing, where a lot of the more mundane activities can be done through an automation system that ties into our enterprise resource planning software, or our ERP. That way, the staff that we do have can work on higher level strategy initiatives and not just be processing, making payments and doing invoices and work orders. The police department also has to replace a legacy system. It's called a CAD-RMS, or computer aided dispatch. That is where they need to become more data driven. They really can't do that until they replace this software, and it is pricey, but they also have some funding that they can contribute to this. We're still working with PUB on LED light retrofits and further energy efficiency improvements to our facilities. There's a joint workshop scheduled for August where we'll talk more about this. We started with Civic Clerk. You may have noticed that how we do our agenda process is different. It's more efficient. There's less paper involved. We haven't scaled that to include our boards and commissions yet. We want to deploy that more. And then we also would like to work with the PUB more on developing a smart city roadmap, so that as we continue looking for ways to further automate, that we're not just kind of shooting from the hip, so to speak, but that we're really following a plan that is well developed and thought out. Next slide, please. And here's some of the business case. Here's the why, or the business case. Some of these, not all the proposed improvements are efficiencies. Some of these are to cover gaps in cybersecurity that were pre-existing that need to be shored up. There are a variety of efficiency improvements. I won't go into each one, but here's just a bit more detail as to what the benefits are going to be from what we're proposing here. And then some of those are just simply end of life. The system at PD is end of life. The mechanical meters in downtown, same thing. They have mechanical components that are outdated. And then we have a variety of operating system needs where, you know, Windows 7 needs to get updated to Windows 10, which is the version that we need to be on as an organization to make sure that we benefit from all the efficiencies that come with a modernized version of Microsoft backend software. Next slide, please. So what you all didn't see in that $1.9 million row that we talked about that we're recommending funding for is there was about another $3 million of department requests that you did not see because there really wasn't, we don't have the resources to fund any of that. So we wouldn't want to take you through an exercise that is not productive. However, one of those departments that was created last year that I do feel is important to highlight is internal services. So internal services, we centralize facilities, fleet, and our call center. And historically, last budget year, we showed you all how we've only invested about less than 1% per year into our facilities. And that's why we had deferred a lot of maintenance. Same thing with a lot of our light to medium fleet. So we started a 10-year plan for fleet. We started working with PUB. We wanted to do the performance contract. We had repurposed some bonds that were initially issued for a library expansion that we've invested in the Children's Museum and roof needs at fire stations and stuff like that. But there's still more to be done. And basically what we're looking at is if we have needs that are more basic to the organization, we really have to look at taking care of our organization before we can provide kind of other community services that really we may not be able to truly afford if we have unmet needs within the organization. A recommendation that we would pose to the commission for a variety of reasons, the Ringgold, we have the potential to work with the Children's Museum for their expansion needs and potentially make use of that in that fashion. But the event center and the Ringgold have about $1 million worth of staffing and operation and maintenance costs that pretty much nets out at $750 because there is some revenue associated, but it doesn't really cover the cost. What we would want to look at is if we could cease offering those services, which is a community space that we offer at both of those locations, and instead look to repurpose that staff and take those savings and reinvest that into other needs that we have and other service levels that could be enhanced within the organization. We have some ideas. We just don't want to propose anything until we have the green light, or if you all perhaps want us to bring that back and then you all can consider further. Then we have, we do recommend suspending the food service at the library because of COVID. We really don't have a lot that we can do and don't want to be in the food handling business. That could help us with supporting a lot of our other customer service needs in the short term. Next slide, please. So beyond that, that pretty much covers the general fund. On the bridge fund, we still recommend keeping the general fund is capped at 3.1, cash funding capital outlay in the amount of 400, continuing the second year of our fleet, primarily because we're still catching up. We haven't fully caught up on the average 12 to 18-year-old light to medium fleet of vehicles. That was a multi-year plan that we're on. So we have the funding and we're still within over 60 days of our fund balance. And then we also have our overtime program that we fund for CBP from the bridge.
Noel, could I ask a question on that one?
Yes, sir.
Okay, so do you have any figures about what the cost or what our cost was, for example, for the end of the year, New Year's and Christmas? Because I think that amount may only account for like one holiday. Have you been able to compare any figures on that?
I don't have it offhand. I'm not sure if Lupe, are you aware of what that number is? Does that include Christmas and spring break?
There's about 4 times of the year, Holy Week, spring break, and then Thanksgiving, and then Christmas and New Year's. So
I don't have that information offhand. I need to look it up.
we can find that out, Ben, and make sure that we are fully funding all the different dates that we.
yeah, I would just ask that you keep that in mind. Thanks.
Yes, sir. Next slide. Here's the landfill fund. The landfill fund would also experience a decline in revenues due to COVID. But if you look at the expenses, they're pretty much fixed expenses, whether it's O&M, debt service payments, and or the transfer to the general fund. We've not been in a position similar to the bridge fund where we can back out some of that 9.3 million. What we have done is capped it, so we're not going to take any more from it, but we are monitoring the fund balance here to make sure that we don't deplete it. At this point, we feel we can go fiscal year 21 without having to make any other. We are going to look at the fees. We'll talk about that in the last slide. So there could be a way to maybe adjust fees to help the fund raise some revenue if there's a need and justification in some areas. But for the most part, we still foresee sustaining this fund another year without significant adjustments. Next slide, please. I'll let Elizabeth cover, Mayor Commission, the OPEB. This is something we talked about last year, and then we talked about the trust fund, which we've created, and then we had to do an analysis to determine if we could afford to provide this service going forward, this benefit. Elizabeth, are you on the call?
I am, sir. Good evening, Mayor, Commissioners. I'm Elizabeth Walker in the Office of the City Manager, and thank you for having me this evening. What I have for you is just 2 slides to present the OPEB and considerations regarding its liability. OPEB, of course, is an acronym that stands for Other Post-Employment Benefits. And in this case, what it speaks to is those benefits for retirees other than the pension. The Texas Local Government Code actually requires that cities extend access to its health plan for retirees. However, it does not require that a city subsidize it, and the city of Brownsville does. It subsidizes it very richly at 100% of the healthcare costs for the retiree upon 20 years of service and after the age of 50 for our police officers and 55 for other employees until such time they're Medicare eligible. The cost of this benefit you'll see in the slide before you. And you'll see that it's increasing exponentially to a liability of $205 million in the year 2049. And the reason why it's growing at the rate that it is primarily 2 factors. The first one is just healthcare costs themselves. They have doubled essentially over the last 10 years. The other factor is just the stability, I think, of our employment. There are as much as 65% of our employees would be eligible for this benefit within the next 10 years, and over half of them would be eligible within the next 5 years. Next slide, please. We worked with an actuary then to model some changes to try to contain that liability. And just speaking to them generally, the scenario 1 is no changes to the OPEB design, to the benefits criteria. Scenarios 2, 3, 4, and 5 are more restrictive, eligibility for participants. Who would be eligible to receive this benefit? And generally speaking, scenario 6 and generally 7 is if there are any changes to the amount of the subsidy, how much it is that the city would contribute to that monthly cost of OPEB. There is an additional model that we considered, but we didn't plot here, and that would be to honor the collective bargaining agreement obligations for our OPEB, which is at least another 2 years for our police and as much as 4 years should that contract evergreen, and aligning access for our other non-civil service employees over the same period, and then shifting the subsidy to an age-adjusted premium. That additional model would hover less than what you see appear as scenario 7 in orange. And it would ultimately phase out entirely within just 15 years, presumably the entire period by which it is employees would be potentially eligible, 50 to 65.
Elizabeth, can I ask a question?
Of course, ma'am.
How do the different scenarios compared to what similar cities offer their retirees?
I appreciate you asking. This is a very rich benefit. The PUB does offer something commensurate, which is 100% of the retiree cost. However, we only found one other city in the whole valley that is presently doing this. That's the city of Edinburgh. And by examining their CAFR, it appears to us that they have a similar liability consideration. They just may not have yet addressed it. I will say that other cities, they may do other things as part of their whole benefits package for retirees. So in looking at South Padre Island, for example, which I realize obviously we're a much bigger city, but just for a closer geographic market comparison, South Padre Island does have a fixed monthly contribution that's kind of on a sliding scale based on the number of years of service to the city. I think it's capped at not to exceed $125 a month. But they do that. They do not contribute to Social Security, which the city of Brownsville does. Similarly, Harlingen, it has a cap on them, I think of $125 a month that it contributes for its retiree OPEB benefit, but it does not participate in the same pension plan that we do. The city of McAllen participates zero. It does not contribute. It will be entirely at the retiree's expense to buy into the health plan.
And we can make the report available. It's a few 20 some pages, or it is a lot more in depth. We just provided the high level, but that would be our recommendation. And it's essentially, if we look at the scenarios, even having done the phase out, the annual commitment to the city is still around $1.5 million for those that are already retired. And just as an example, you saw the $1.6 million that came in to fund the entire city. That number for the annual OPEB amount rivals what we bring in just to run the general government. So that's part of where this is not a sustainable benefit.
Hey, Mr. Bernal, I'd like to see the extra documents, extra pages. Just email them to me so I can see all the different scenarios.
I believe I sent that to you, Mayor. You have that. You should have that email.
Oh, is that the one? Okay, got it.
I sent it to you initially. We were going to plan for a high-level update, but
okay,
we'll send it to the commission as well.
Got it. Thank you.
Yeah.
So these figures and discussions are applying to all the employees across the board, all the city employees, all?
Yes, sir.
Yes, Commissioner. The different scenarios, yes, sir. The different scenarios are increasingly restrictive. Some of these scenarios are only affect, for example, future employees. Some of these scenarios are current employees, but those who are 10 years from retirement, 5 years from retirement. Ultimately, what each of the scenarios illustrated for us is that in order to have a true impact on the liability, it was not enough to just make scaled changes. We truly need to make structural changes and two-pronged structural changes to both those who would be defined as eligible for this benefit, as well as how much the city would subsidize it for them.
Okay, so I would also like a breakdown on the different scenarios to see how you arrived at those figures.
Of course, Commissioner, I'll be happy to forward to you the actuary's modeled report.
Thank you.
Thank you, Elizabeth. So Mayor and Commission, that pretty much is the workshop we have for today. For the most part, we're still fortunate to have a balanced budget for fiscal year 21, and also one that allows us to further some of the Commission's goals and organizational needs that we have. We're not facing cuts and things of that sort, and we have begun to build systems that will help us shift how we do business even into fiscal 22. So the work doesn't stop. This is like a one-year snapshot. We have the work cut out still, as y'all saw in that sales tax chart, for out years, and how we need to still sustain ourselves into the next 2 to 3 years. What we have in the next workshop on August the 4th is our capital improvement program, our CIP, the master fee schedule, fee adjustments that correspond with that. We have the hot tax presentation, and then depending on the commission feedback, we can leave the Civic Pavilion and Event Center suggestion alone, or we can come back and show you all how we would propose potentially shifting some of those resources. I'd be happy to answer any questions.
Hey, Noel, I have a quick question on the sales tax number that is proposed for next year. What is the assumption? I know you presented a range of potential scenarios. What is the assumption again for next year in comparison to fiscal year 2020?
This year we had when we sent the outlook back in March, we had a 10, 15, and 20%. We had 1 month at kind of almost 10%, and then we had a month go up when the reopening happened by like 1% or 5%, but 1% over year. So we're using a 15% for fiscal 21. For fiscal year 20, we're still not out of the woods yet, but we wouldn't likely face we don't foresee a double-digit loss, mostly because the first 6 months of the year, we were up over 5%. So that already kind of gave us some headwind going into when COVID hit in March, we were ahead for the year. So we kind of had the mid-month of March go down, then April go down a lot, and then June went back up. But it's going to kind of normalize. We would have to have upwards of 20% for the month of June, July, August, September to hit 10% in the aggregate under for the fiscal year 20 budget. We also confer with our financial advisor, and he's been advising his client cities throughout Texas and even beyond. And he actually had recommended, and even he had 30% that he recommended. So we kind of met in the middle somewhere, and then we showed him our assessment and our true numbers. So as you saw, that's our true Great Recession experience right there. And if you looked at that peak in 2009, Brownsville peaked at the lowest of 8%. We already have peaked down to 15% just in a quick 1 month, but then it's kind of going back up, and that's tied to the reopening. At this point, it's anybody's guess how things are going to work from month to month.
And I know you mentioned, I think a few meetings ago about the new changes on the e-commerce allocation for sales tax. Is there an update on that?
That goes into effect. The comptroller has put out a white paper. It goes into effect October 2021.
Okay.
Yeah, and we are tracking that. Our annual number for online sales tax, which is primarily driven by Amazon, and they're the heavy hitter in the e-commerce space in terms of kind of general retail. It's around $250 a year. We can ask Lupe to check further to see kind of where we end up for fiscal 20, but we had seen about $250,000 of online sales. Also, I think we briefly talked about this during the budget committees, that a lot of what's going to happen when the sales tax rule goes into effect is that those cities that have an industrial presence with more business-to-business type sales, those are the ones that are going to kind of see the more significant increases, because every city will see an increase or a change tied to its consumption and disposable income levels. So basically, what that trend that you see there, that's kind of been our upward trend over time, and something similar would correlate online in a virtual manner once that happens. So there shouldn't be a disproportionate spike unless we get some warehousing or those types of businesses that actually pay more business personal property and business to business sales tax.
Thank you.
Yes, sir.
Thank you.
Thank you. Okay, thank you. Look forward to August the 4th.
Next, we have items for individual consideration. Item number 1, consideration and action on the 9th Amendment Declaration of Local Disaster for Public Health Emergency.
Good evening, Mayor and Council. Mayor, I don't know if you want me to start or you want to give a brief introduction.
Sure. I'm going to have to sign off in just about 10 minutes or so, but what we're going to do is the last meeting we had in regards to this amended order, we did our 8th amended order, and it was good till August the 4th. However, we're seeing some trends, and we've seen a lot of high numbers. Certainly, the deaths numbers have gone up. So I believe that we need some tighter restrictions. I think one of the ways we get there is through reduced occupancy, reduced capacity, and also considering other requirements. We already have, as y'all may remember, we have already established a curfew in line with the county. I think also, other than the reduced capacity, which I think we can scale down to 25%, I think also Dr. McCormick has recommended that we stress a little bit of a wider distance in between individuals from 6 feet to 8 feet. Small difference, but it certainly does help, at least according to Dr. McCormick, which I certainly don't disagree with his opinion. There's also some scaling back of occupancies on bingo halls, bowling alleys, and then I think that's pretty much it. Ms. Ramirez, do you want to just go ahead and elaborate on some of the at least suggested changes? Obviously, open to the commission's recommendations.
Yes, absolutely. I think one of the premises is the rates of infection are increasing at an alarming rate, as demonstrated by the number of people admitted to hospitals, intensive care units, the rising need for ventilators despite efforts by the city of Brownsville and our regional and our local hospitals to control the spread. Specifically related to restaurants, restaurants can operate at up to 25% of the total listed occupancy of the restaurant, provided compliance with all tables shall be placed at a minimum of 8 feet apart from one another. So that goes in line with the additional social distancing. Businesses are encouraged to implement takeout procedures whereby food is placed in the trunk or backseat of a vehicle and patrons pay via telephone or electronic means. With regard to retail stores, employees must wear facial coverings. Shopping malls, we also stress that they have to comply with the social distancing requirements in such a large area, and also employees must wear facial coverings. With regard to cosmetology salons, hair salons, barbershop, nail salons, shops, tanning salons, massage establishments, and other related establishments, they are in the last measure, we limited to no more than 10 persons of occupancy, not to include employees, but now we're adding that they must ensure at least 8 feet of social distancing between operating workstations. With regard to gyms and exercise facilities and classes, that may not operate more than 25% of the total listed occupancy of the gym or exercise facility, and participants must wear a facial covering at all times.
If I can jump in really quickly, Helen, on the gyms, Commissioner Cowan and I had a conference call yesterday with a couple gym owners just to kind of pick their brain, to get their idea of what it is that they're doing, what kind of protocols they're following, what it is that they're doing at their establishments. And we found that a lot of gyms are already implementing 25%. They're disinfecting equipment in between uses, but I know that Hard Knocks, for example, Orange Theory are both, they scaled back to 25%. And they did advise that most gyms are doing that already, just to keep their clients or their customers safe as much as possible. What they were not doing was requiring face masks to be worn during the exercise. I did recommend, and it's in here, that we do ask them to wear facial coverings while they're exercising, because we know that the virus can aerosolize and travel further than 6 or 8 feet. So that's definitely a concern. Even if you have open areas and other spaces like that, it's still a concern. And they said that would not be an issue. They didn't think that would be an issue with any of their patrons at all. So that was something that we thought we could scale back and still accomplish the same goal.
Trey, Mayor, did they say anything about thoughts on locker rooms or changing areas in those gyms that do have those areas? Because, you know, staff is not watching necessarily those areas.
You know, Dr. Gowan, I honestly didn't ask that question. I don't know whether they themselves, the ones that we spoke to, have those facilities. I quite honestly don't know, but I didn't ask that question.
Yeah, and I'd like to add that a lot of these gyms are allowing their members to work out outside if they have the space available. So that's an added precaution as well.
That's a great idea. And I think we should somehow incentivize or encourage that. It's well for restaurants. The more restaurants that provide outdoor seating, the safer their patrons are.
I'm glad
commissioners, we did get that question early on. Can we do it outside? And we absolutely, some people were even doing it in their parking area, but they were maintaining at least up to 8 feet, sometimes 10 feet distance between.
Right. And the other item that Dr. McCormick mentioned was freestanding HEPA filters that I don't know how much they cost. I don't think they're very expensive, but I would encourage BCIC and GBIC to look into that and see whether they can figure some kind of grant program for restaurants or small businesses that want to be additionally safe, and they can set up it's just a freestanding HEPA filter that will decrease the viral load if it happens to be in the air.
And I think that would be a great program as well for PUB with their incentive program, where you change out some of the things in your house, and for businesses, of course. I'm really glad that you all did research on gyms, because I don't know anything about gyms because I clearly don't go to any of them. So I'm glad that you all reached out, because I really have no idea how they work or any of that. I mean, I'm assuming they have a locker room, but that's beyond my scope of knowledge.
Well, my concern, Commissioner, was dealing small business another big blow that they may not be able to recover from.
Right.
So I wanted to do my homework and at least get educated on how they were doing it, what they thought they could do, and I was surprised to learn that they were already doing it.
That's great.
Another measure is for person care and beauty services such as tattoo studios, piercing studios, hair removal, or hair loss. Ensure that at least 8 feet of social distancing between workstations, and they are limited from our last measures to no more than 10 persons of occupancy. A new measure that the health department has included states the following: it is strongly recommended to implement best practices while following the appropriate course of action for public school districts as they utilize the Texas Education Agency public health planning guidance available at www.texas.gov sites, specifically to provide notice, which is requirements for parental and public notices to prevent by requiring practices to prevent the virus from entering the school, to respond by requiring practices to respond to a lab confirmed case in the school, to mitigate by recommended and required practices to reduce the likely spread inside the school. After a period of remote learning has been implemented and in-class instruction has been approved by the City of Brownsville Health Authority, desks must be at least 8 feet apart and HEPA filters must be present in each instructional room. A COVID summary plan providing for the safety of students and teachers must be available at the school website and is strongly encouraged alongside a point of contact within the public school district. Masks must be worn by school-aged children while on campus. I believe that extends to teachers as well. In accordance with Section 81.02 of the Texas Health and Safety Code, the City of Brownsville Health Authority and acting health officer state remote learning is an accessible substitute for in-class instruction while public health risks exist, such as high COVID-19 positivity rates and hospitalization occupancy rates above 90% that continue to pose a public health emergency. Next, bingo halls and bowling alleys may operate at up to 25% of the total listed occupancy of the establishment. Bowling alleys must ensure at least 8 feet of social distancing between operating lanes. With regard to elective procedures, medical and surgical procedures are prohibited. We did eliminate dental. I believe the mayor did speak to the American Dental Association and can provide more input as to why we believe that still doesn't pose a big threat with regard to our current situation.
Sure, actually the Texas Dental Association's requirements are way stricter than what we were even requiring. and they're taking extreme measures. And I did have a long discussion with them, and we issued a clarification on that last week in regards to dentists and procedures, not using hand tools. They're already not allowed to use hand tools for regular procedures, only emergency procedures, et cetera. So it was already where we wanted it to be.
City tennis courts may reopen in strict compliance with terms required by the Texas Department of State Health Services and city requirements. So that is an option. And that concludes the revisions that we have included in this ninth amended local measure. Thank you.
Anybody have any questions or any other concerns, issues?
My concern was with the bingo halls, because we do have a very large amount of elderly citizens that do gather there. I just wanted to make sure that city was being very strict with occupancy rules. I have heard of some bingo halls that may not have been following it, and that concerned me. And the 8 feet, would this apply at bingo halls as well?
It talks about bowling alleys there, but I was going to ask that bingo halls be included there, so that would just be a small amendment.
Yeah.
Yes. Yeah, we can include the. I believe that our Dr. Rodriguez, they have been monitoring and actually stopping by the bingo halls to ensure it, and so I can speak more on that, but I believe they have been complying from what the reports I've been getting.
As long as we include that in there as an amendment, I think we'll be okay.
I just want to take very strict precautions with them, because those are the community members that would be most affected by catching COVID, and they're in there for a long time. I don't know about gyms, but I do know about bingo.
Same for gym. Yeah.
And Honorable Mayor, Commissioners, we have been to the bingo halls for that reason, because bingo halls attract the older, the most vulnerable. They are there for 2 hours, and it's closed setting. So we have been very adamant about the conditions in those locations. And I believe we did address that in the amendment. If we didn't, we certainly need to add them.
You know what, Art? I think bingo halls should put up HEPA filters. They could certainly afford to go, well, I shouldn't say that, but I think they could afford to go down to Home Depot and buy a few.
Yeah. I agree.
Is there any way that we can enforce taking temperatures of people before they enter a building?
So there are some documents out by the CDC that encourage businesses to reduce liability by taking measures within that scope of measures. Sometimes it includes temperature at the point of entry. Different businesses choose different measures that they put in place, but it certainly can be some recommendations that we have for those businesses, as we've been doing with some of the retail stores. That temperature checks is one of them. Now keep in mind that 80% of people will be asymptomatic and have no fever. But I know what you're chasing after. I think you're saying that's better than nothing, and I get it. But certainly we want to look at the measures in the big scope of trying to just reduce the social distancing, because I think that's the biggest threat. Because we do know that to a certain degree, the COVID virus can be airborne for a certain period of time, even in people who have no temperature at the time.
We've seen what it can do to nursing homes, and I just want to make sure that we're taking every precaution possible, and that people say Brownsville takes this very seriously.
Absolutely. Yes, ma'am.
Thank you.
I'd like to make a motion to approve.
With the amendments, right?
With the amendments, I'm sorry.
The filter, the 8 feet on bingo halls.
Correct.
I'll second.
We have a motion and a second. Any further discussion? Those in favor?
Aye.
Aye.
Aye. Those opposed? Motion passes. Okay. Thank you, guys. I'm sorry, I got to sign off. If I can sign back on later, I will, but I had a meeting with some other mayors in the state. So whoever, I don't know who the pro tem is this month, but take over. Thanks.
Mayor, have fun.
Thank you.
Who's in charge?
Give me 1 minute, ma'am.
So there's a rotation. I'm sure Gisela can verify for us.
Commissioner Alcala, you are the next person that would be in line.
I was going to nominate you anyway.
think I've had to do this every time that Trey's been out, but let's do it.
Okay. The next agenda item that we have is action item number 2, consideration and action to award change order number 10 to Spa Glass in the amount of $863,697.10 to provide biometrics and additional technology solutions for the terminal project at the Brownsville South Padre Island International Airport.
Good evening, Mayor Pro Tem, Honorable Mayor Pro Tem and Commissioners. Bryant Walker, I'm the Assistant City Manager for the city as well as the Aviation Administrator. And tonight we are presenting this request for funding for some additional technology items and to include some additional biometric items as well. And the airport recommends that we award this to Spa Glass.
I'll make the motion to approve.
All right, we have a motion. Do we have a second?
Second.
We have a second. All those, any comments or questions? If not, all those in favor, please state aye.
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 All those- Motion carried.
Thank you very much.
Thank you.
Next, we have agenda item number 3, consideration and action to approve resolution number 2020-071 in support of the Brownsville Independent School District closing of schools, adoption and implementation of safe return protocols that will ensure the safe return of our children and educators to in-person instruction.
I will gladly make the motion to approve.
All right, we have a motion. Do we have a second?
Second.
We have a second. Any further discussion? All those in favor, please state aye.
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 All opposed? Motion carries. Thank you, guys.
Next, we have executive session number 1, attorney consultation pursuant to section 551.0712 Texas Government Code to receive legal advice and counsel in connection with the city's rights, duties, privileges, obligations, possible resolution, and related legal issues arising out of grievance filed with the Brownsville Professional Fire Association. Executive session number 2, deliberation of personnel matters pursuant to section 551.0741 of the Texas Government Code related to the evaluation of a public officer or employee, to wit, City Manager Noel Bernal.
I'll make the motion to go into executive session.
All right, we have a motion. Do we have a second?
Second.
We have a second. All those in favor, please state aye.
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 Motion carries. We are now going to executive session. Thank you, guys.
Commissioner Gowan, Commissioner Galansky Pisanya, Commissioner.
Here.
Tet- and Commissioner Neese, are you on? Yes. We do have a quorum. It is now 8:09. We can go ahead and go to the last agenda item, which is possible action on any items as discussed in executive session, which is number 1, discussion and possible action to provide a temporary hazard pay stipend to the fire and police department.
I believe there's no action here.
Commissioner, it still needs to come up for a vote.
Okay, I'd like to entertain a motion.
Motion for no action?
Motion to adjourn.
Second.
Second.
Oh, we need a second for the.
Yeah. Yes, it could be as a motion to pass with the instructions given.
But I thought it was no action, but
Another recommendation.
There's no motion needed.
Okay, just wanted to clarify.
Yep.
No
you.
action
All right.
needed, so there's a
We-
motion.
We have a motion on the table for adjourn. We have a second.
second.
We have a second. All those in favor, please say aye.
Aye.
Meeting adjourned. Thank you.
Bye.
Bye, stay safe, everyone.
Have a good night.
Take
You too,
care.
guys.
It's now 8:10, end of the meeting.